ਤੋ ਜੁੜੇ ਪ੍ਰੋਗਰਾਮ ਖਬਰਸਾਰ ਦੇ ਨਾਲ ਸਵੇਰੇ 8 ਵਜੇ ਤੋਂ ਲੈ ਕੇ 10 ਵਜੇ ਤੱਕ ਅਸੀਂ ਇਹ ਪ੍ਰੋਗਰਾਮ ਪੇਸ਼ ਕਰਦੇ ਹਾਂ। ਜਿਸ ਤਰ੍ਹਾਂ ਅਸੀਂ ਅਨਾਊਂਸ ਕਰ ਚੁੱਕੇ ਹਾਂ ਕਿ 8:45 ਦੇ ਉੱਤੇ ਸਾਡੇ ਨਾਲ ਸਾਡੀ NDP ਪਾਰਟੀ ਦੇ ਲੀਡਰ ਅੰਟਾਰੀਓ ਦੇ ਅਤੇ ਨਾਲ ਦੀ ਨਾਲ ਸਾਡੀ ਆਪੋਜੀਸ਼ਨ ਲੀਡਰ ਐਂਡੀ ਹਾਰਬਰਟ ਸਾਡੇ ਨਾਲ ਹੋਣਗੇ, ਸਾਡੇ ਨਾਲ ਜੁੜ ਚੁੱਕੇ ਨੇ। ਉਹਨਾਂ ਨੂੰ ਅਸੀਂ ਜੀ ਆਇਆਂ ਆਖਾਂਗੇ ਅਤੇ ਨਾਲ ਦੀ ਨਾਲ ਉਹਨਾਂ ਦੇ ਨਾਲ ਕੁਝ ਇਸ ਸਮੇਂ ਜੋ ਕਰੰਟ ਸਥਿਤੀ ਹੈ ਅੰਟਾਰੀਓ ਦੀ ਉਸ ਦੇ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਕਰਾਂਗੇ। Andrea, welcome to the show and good morning to you.
Good morning to you. I'm very pleased to be with you again.
Thank you so much sparing some time. And how are you keeping?
I'm keeping very well. Thank you for asking, and my family as well. And how about you?
Very good. And we're all staying at home. And
yes.
We're safe at home. We're not stuck at home. We're safe at home.
That's exactly right. It's a very good way of putting it. Absolutely.
All right. Andrea, so recently our Premier Doug Ford have released a framework or roadmap to reopen Ontario. What's your say on it?
Well, you know, I have to say that there's no doubt that taking a cautious approach is the way to go, and taking the advice of medical experts is the way to go. But I have some concerns about some of the missing information. I mean, I know people are not happy about the vagueness in terms of, identifying which businesses or which sectors might be opening first. But my concerns are more focused on, are we ready? Like, what have we done? What has the province done to prepare? Do we have a massive capacity for more testing? Do we have the capacity and the commitment to do proactive inspections in workplaces before they open, to make sure that they are that they have accommodated the new normal in terms of distancing, right? These things are extremely important. Do we have enough PPE, personal protective equipment, for folks where distancing might not be as effective or as possible? Is everybody who is going to need personal protective equipment, going to be able to get it? And these things are important because the last thing we want is a second wave. Or the last thing we want is a new wave, right?
Mm-hmm.
Yeah.
And yet, one point we are talking about to reopen Ontario, reopen our economy, and the other hand, if we are listening to today's news, even our chief medical officers, even yesterday, Premier Doug Ford, and even Prime Minister said yesterday that we are not out of the woods yet. But the main concern of the doctors and the politicians and everybody else is that now, even after this lockdown, even after having so strict measures for social distancing is still, expanding, is still transmitting from one person to other person. How this transmission can be stopped of this coronavirus? This is the biggest question today, even after such a lockdown.
Well, I mean, I think that's the point. I think the answer is that we're hearing from public health and from the chief medical officers, both at the federal level and at the provincial level, is we cannot stop the virus from traveling. The virus won't be the virus will still be amongst us until we get a vaccine or until we have immunity. But I don't think either of those things are coming anytime soon, which is, and as well, we don't even have any real treatment for people who do get sick. And that's why when we talk about things like opening up, relaxing some of these restrictions, that we have to be very, very careful because it won't take much to flare everything up again, and create even more heartbreak and chaos for families and frontline workers, right? And people who might get sick. So that's the whole point.
The safety of the long-term care center are still in question. It's still spreading. It's not slowing down. What do you think? What kind of measure we should take to slow down at the senior centers?
Yeah, I mean, it's pretty tragic what's happening there. I'm glad you raised it. I mean, nearly 700 of the more than 900 people now in Ontario who have passed away from COVID-19 are long-term care residents. It's just tragic for them, and for their families, and people who have family members in long-term care now are absolutely terrified of what might happen, and residents are terrified of what might happen. So, I mean, I think we have to be really grateful of every minute that frontline staff or home care, or rather long-term care staff are spending in those homes trying to take care of people. But we're not winning that battle. You're absolutely right. It continues to get worse, and there's been a class action lawsuit that's being attempted against some of the homes for failing to protect the residents. And I think we really have to take a hard look at how private for-profit homes, for example, have turned down help when it was offered from the province. What we need to do is have urgent new measures to fix what's happening now, and then take a hard look in the future at what we need to do to transform that system. But in the meantime, there's some things that need to be done. We need to make sure that there are mandated minimum staffing levels, mandated infection control and isolation requirements. We need to make sure that the PPE, including those N95 masks, are available to all the homes that need them. And one of the things I'm hearing is that family members are not getting information that they should be getting about their loved ones and their state of health. And so there needs to be much more communication to residents and their families, and that needs to be mandated by the government as well.
You mentioned before the capacity of our healthcare system. Do you think we are capable, or do you have full belief in our healthcare system now that we are capable of handling all these patients, or even if the coronavirus goes worse, do you think we are ready for it now, or we still need to be done a little bit more?
Well, I think we need to be, frank about what the hospitals have done, right? And I give them all the credit in the world. We were very worried that the hospitals wouldn't be able to handle this, because we all know that hallway medicine has been a big problem in Ontario, and the hospitals simply haven't had the capacity for normal, everyday needs of Ontarians. But what the hospitals did is they put together an aggressive plan to move people out of hospital, to cancel, elective surgeries and non-urgent surgeries, and that's what gave the room for those COVID-19 patients. That can't last forever, though, and we're hearing very troubling stories about what some of the people the fate of some of the people who didn't get the surgeries that they needed in an urgent way. And we're hearing that people have lost their lives in that situation. And again, this isn't to put blame, but it's to take a hard look at what really has gone on here. And what was done, it wasn't done without consequences. Do you know what I mean? And I think that's what we need to look at in terms of the capacity for if we were to get another huge second wave in the future. Is that what we want? Do we want cancer patients not to be able to get their treatments? Do we want urgent surgeries that are not that are like to be canceled and have those people lose their lives while they're waiting for rescheduling? I mean, these are the choices that have had to be made, but we need to think clearly about making sure our hospital system is actually in shape to be able to take on a surge for the next time either this COVID-19 comes back, which we hope it doesn't, and we're going to do everything we can to stay home and to distance to make sure it doesn't, but who knows what the future will bring. So we have some lessons to learn, I think.
And we have, just a couple of days ago, both our federal and provincial government jointly released a big relief for the commercial businesses, which is called CECRA. Do you think it's satisfactory, or there's some cracks that a lot of people will fall through it? Do you think it need to be improved, or you're happy with it?
Well, we are hearing from the business community that there are lots of cracks and that there are lots of people falling through. And one of the things I just can't understand is why we have a program that basically the landlord determines whether or not the business is going to stay afloat, because the landlord's the one to determine whether or not to take the package. So I don't understand that at all off the hop. But we're hearing that a lot of small businesses and folks who run community-based organizations, not-for-profits and charities are literally counting down the days. I mean, folks are really feeling that this package is not helping them. And what we know is that these choices are literally being made as we speak, because May 1st is coming in a couple days' time, and and small operations are literally having to choose between closing up shop or taking on massive debt to try to pay the rent. And we know that charities and not-for-profits are worried about how they're going to be able to serve communities if they can't stay afloat. So that help from the federal government is welcome, but it is not enough to save small businesses, and in some cases not enough to save medium-sized enterprises as well. And unfortunately, the provincial government hasn't provided any real direct support to small and medium-sized businesses. They gave some tax credits, but you can't really make use of a tax credit if there's no revenue coming in. So we've encouraged the provincial government to look at something that directly helps small business by helping them pay the rent. So a 75% rent subsidy for up to 3 months to a maximum of $10,000 a month. To help with those commercial rents. We want a utility payment freeze. We want a fund to help folks to set up online or some remote kind of solutions. We want some auto insurance, grace periods for taxis and car sharing drivers. There's just a lot that could be done to help these small businesses. And what I really fear is that if we let these businesses fall by the wayside, and these, not only businesses go under, but we're hearing stories about, families going bankrupt, like total bankruptcy because of the lack of support. It's going to be so much harder to get our economy going, and it's going to devastate so many people if we don't step in now and try to save these businesses and these communities.
Do you have any answer for this? Like, why these both governments give this benefits, like they are left onto the mercy of landlord if he applies or if he not applies? Do you think that's the best practice, or they should have given it to the actually tenant who have the leasing agreement with the landlord, and he should be claiming against that or against that leasing agreement that this is how much he's paying, this is how much he should get from the government? So the landlord is the best thing, or the tenant should have been the best thing?
No, I think the commercial tenant should have been the person or the entity to receive the support, because I mean, it just makes sense. First of all, they're the ones who have signed on to these lease agreements and contracts, and so they need to be the ones to be able to receive the benefit so that they can be in a compliance with their lease agreements or their contracts, and this is what's worrying people, is because in some cases these lease agreements have some pretty stringent, strict terms, right? That include really serious financial penalties that last in some cases for years. I mean, it's quite troubling. So I have no understanding as to why the government of Canada did what they did. It doesn't make any sense whatsoever. And again, as I said already, I mean, what you're really doing is saying then the landlords get to decide which businesses are going to be able to survive and which are not. And that should not be the case. It should be, the entrepreneur, the business owner, that should determine, their ability to take advantage of a government program and, cobble together what they need to stay afloat.
And I also would like to thank you for standing up for the ethnic media. Your recent statement is standing by all the ethnic media for that you demand from the government to support the ethnic media as well. Thank you so much for that.
Oh, no, I thank you for mentioning it. It's so apparent, and it has been. I mean, I've known for my entire political career anyways, and even when I was doing work in the community, how important the ethnic media and small community newspapers and media outlets, radio and others are, how important they are to providing information to communities, to people in their own languages, and that's relevant to their own kind of environment, and so the the pain that's being felt by small business is also being felt by these various media outlets, of course, because they're businesses as well, but often running on running on a thread in terms of revenue, advertising revenue, and those kinds of things. And so, what we want to do is make sure that the government is aware of this, that they realize the benefit and the positive contributions that these media sources provide to our province as a whole, and respond to that by putting together a fund to help stabilize the industry during these uncertain times, as well as a commitment to advertising in those media sources. I mean, that's two ways of providing some financial support that are so necessary.
Mm-hmm. So, given that ethnic broadcasters do not fit the standard definition to avail CECRA benefits, like at this time, I have a 2 hours time slot here. I have a lease agreement with the station that I will use your studio for 2 hours, your air time for 2 hours. This is our agreement. This is how much I will pay. So this does not fit into that. So we want that we should be covered under this CECRA, as we have a leasing agreement with the station that we are renting this time slot, and we should be, like our station should be getting that 75% or 50% from the government and 25%. They already gave us a little bit discount. I thank you, the owner of the channel, and rest we put it out of our pocket. This is what the letter we are sending out from our Canadian Punjabi Broadcasters Associations, and South Asian Press Club is also sending a letters, and yesterday I saw National Ethnic Press Club's open letter to the Prime Minister as well. So this is what our thinking is, that we should fall under this CECRA benefits plan.
Well, and if that's something that you think is going to solve the bind that you're in terms of your lease agreements, then I'm happy to kind of support that. I guess what I'm saying is, if we don't end up in that situation, if the federal government doesn't change the regulations or the eligibility, or if there are stations that don't want to or refuse to engage in that program, then the provincial government needs to be there to support the ethnic media.
All right. Thank you so much, Henry, and we do appreciate your initiative to support us and releasing that statement from your side.
Well, thank you so much. Thank you so much for everything you do to keep engaged with the community. Very much appreciated.
Thank you.
Thank you. Take care. Bye-bye.